Welcome to another deep dive from Optic Surgeon, the Ophthalmology podcast. Today we're tackling the often perplexing experience of distorted vision. We've got some great material you shared. Our goal is really to clarify the key reasons why things might not look quite right to you.
Exactly. And distorted vision, it isn't just simple blurriness, is it? It can show up in, well, many ways. Understanding these different presentations that can point us towards what might be going on beneath the surface.
Right, connecting the dots.
We'll be connecting those dots between the visual changes and their, potential causes.
Okay, let's unpack this then. Your sources highlight that distorted vision is quite a broad term. We could be talking about seeing wavy lines where they should be straight.
Yeah, like looking at door frames or tiles.
Or noticing blurry spots that maybe come and go. Or even feeling like the size or shape of objects is, well, off.
Precisely. And while these things might sometimes be fleeting, just temporary, it's really crucial to pay attention. They can be subtle signals from your eyes.
Signals that something needs a closer look.
Exactly. That something needs examination.
Okay. One of the first things your material emphasized was the cornea. That clear protective window right at the front of the eye. It sounds like any disruption there can really throw off our vision.
It absolutely can. The cornea is the eye's main focusing surface. Think of it like the front lens element on a camera.
Right.
If there are irregularities, any bumps or unevenness, the light entering your eye won't focus correctly onto the retina.
Leading to distortion.
Leading to distortion. Even something really common like dry eye that can cause tiny surface imperfections. Superficial punctate keratopathy, technically.
And that causes blur or distortion.
It can, yeah. Usually temporary, but definitely noticeable.
What about a teratium? I always thought of that as just, a growth on the side.
It is a growth, typically starting on the conjunctiva, the white part. But the issue is when it grows onto the cornea.
Ah, I see.
Because then it physically changes the cornea's smooth curve.
Yeah.
You pull on it, inducing astigmatism.
Like warping the surface.
Exactly. Imagine a perfectly round ball getting slightly squashed. That irregular shape distorts how light focuses. If it starts affecting your central vision or causes significant distortion, it might need surgery.
Makes sense.
Yeah.
The sources also mentioned corneal dystrophies. These sound like more inherent issues within the cornea itself.
Yes, exactly. These are usually genetic conditions. Abnormal material builds up within the corneal layers.
Like internal flaws.
Sort of. Think of it like having tiny imperfections embedded within that clear window. Things like lattice, granular, and macular dystrophy. They create these opacities.
Which blurs or distorts vision.
Correct. Macular dystrophy in particular can cause a more significant vision decrease later on.
Fuchs endothelial dystrophy was another one mentioned. That targets a very specific layer, right?
That's right. Fuchs affects the endothelium. That's the innermost layer, the pump layer.
Pump?
Yeah, its job is to pump fluid out of the cornea to keep it clear. When that pump starts to fail, fluid builds up. That causes corneal edema, swelling,
And the symptoms.
glare, blurred vision. Often it's most noticeable when you first wake up.
Why then?
Because your eyes are closed overnight, the fluid isn't evaporating as much, and the pump isn't keeping up as well. Sometimes little blisters, bullae, can form on the surface.
Ouch.
Yeah, if they rupture, it can be quite painful. A phakic or pseudophakic bullous keratopathy is similar corneal swelling after cataract surgery.
Okay. It's almost, paradoxical that procedures meant to improve vision, like LASIK, or even older ones like archaic,
Radial keratotomy, yeah.
it can sometimes result in distortion themselves.
It's true. While they're generally very successful, complications can happen. You might end up with decreased sharpness, really bothersome glare, maybe seeing double out of one eye.
Macular diplopia.
Right, and irregular astigmatism. All of these can definitely manifest as distorted vision.
And, of course, infections. Some of those sounded quite serious.
Oh, absolutely. Bacterial keratitis, fungal, or acanthamoeba. These can cause significant damage to the cornea, and significant damage often means scarring or irregularity, leading to visual distortion.
Acanthamoeba.
Yeah,
That's the one linked to contact lenses sometimes.
often linked to contact lens wear, especially with poor hygiene or tap water exposure. It can even inflame the corneal nerves, radial keratorhinitis.
And viruses, too, like herpes.
Yep, herpes simplex, the cold sore virus, and varicella zoster, the shingles virus, can both affect the cornea. They can cause lesions, scarring,
And potential distortion.
and potential distortion, yes.
Speaking of contacts, it seems they come with their own set of potential distortion issues beyond just acanthamoeba.
They do. Aside from infection risk, you can get hypersensitivity reactions or a condition called giant papillary conjunctivitis, GPC.
Okay.
These can all cause symptoms like pain, redness, reduced vision, and that feeling that things just don't look quite right. Distortion.
Neurotrophic keratopathy was also mentioned. That sounds nerve-related, affecting the cornea.
Exactly right. It involves decreased corneal sensation. The nerves aren't working properly.
What causes that?
It can be a side effect of certain topical medications or sometimes follow ocular surgery, or even stem from conditions like diabetes or herpes zoster. Because the cornea can't feel injury or dryness properly, it's more prone to break down ulcers,
Which leads to distortion.
which can ultimately distort vision, yes.
Okay, let's shift focus a bit. Moving deeper inside the eye, the lens, where cataracts form. That seems like another major player in visual distortion.
Definitely. A cataract is just a clouding of the eye's natural lens. It's incredibly common, especially as we age. And it's a very frequent cause of distorted or blurred vision.
Does the type of cataract matter for distortion?
It can, yes. For instance, a posterior subcapsular cataract right at the back of the lens often causes significant glare and makes reading difficult.
Right.
A nuclear cataract in the center can sometimes cause a myopic shift, making you more nearsighted, which changes how you see things. And in kids, congenital cataracts can even show up as a white reflex in the pupil instead of the usual red one.
Wow, and the lens can actually move, dislocate.
It can. The lens is held in place by tiny fibers called zonules. If these weaken or break, maybe due to trauma or conditions like Marfan syndrome or exfoliative glaucoma, the lens can shift out of position.
And that would cause distortion.
Oh, yes. Definitely causes visual distortion and blur.
Okay, moving even further back now. To the retina, it seems problems hitting the macula, our central vision hub, are really key drivers of distortion.
That's absolutely right. The macula is responsible for our sharp, detailed, straight-ahead vision, so anything affecting it
Is likely to cause distortion.
very likely. You'll notice things like straight lines appearing wavy or bent. Central serous choroidal retinopathy, CSCR, is a good example.
What happens there?
Basically, fluid leaks under the macula, causing a localized detachment. People often notice a central blurry or grayish spot, and definitely that distortion of straight lines. An Amsler grid test is great for picking that up.
Right, the grid test. And age-related macular degeneration, AMD, that's another big one, isn't it?
Huge. Both forms, dry and wet, can cause significant central vision loss and distortion. In wet AMD, you get abnormal blood vessels growing under the macula, choroidal neovascularization.
And they leak.
They leak fluid and blood, which lifts and distorts the retinal tissue even more. That causes quite profound distortion often.
There was also something called idiopathic polypoidal choroidal vasculopathy, IPCV.
Yes, that's sort of related to AMD, but distinct. You see these polyp-like lesions in the choroidal vessels under the retina. They can also bleed or leak,
Causing distortion.
causing decreased and distorted central vision, yes.
I was also interested to see epiretinal membranes and macular holes listed. These are at the interface.
Exactly, the vitreoretinal interface. Where the vitreous gel meets the retina, an epiretinal membrane, or ERM, is like a thin film of scar tissue that forms on the macular surface.
Like cellophane.
Sometimes called that, yeah. It can contract and wrinkle the retina underneath.
It would distort things.
Precisely. And a macular hole is literally a small break or hole that develops right in the center of the macula. That also causes distorted and reduced central vision.
Retinal detachments seem obviously serious for vision loss, but how do they tie into distortion specifically?
Well, when a portion of the retina detaches, it's no longer in its proper position to receive focused light. So the area that's detached causes a field defect, a blank spot. But the area around it, or if the macula itself is partially detached or wrinkled,
That part can see distortedly.
exactly. You can get significant distortion along with the field loss, regardless of the cause, rhegmatogenous, tractional, or exudative detachment.
Okay. And what about problems with blood flow in the retina itself?
Those can definitely cause issues. A central retinal artery occlusion, CRAO, or a branch retinal artery occlusion, BRAO, those cause sudden, often severe vision loss.
And distortion.
Depending on the area affected and whether the macula is involved, you might experience distortion in whatever vision remains or perceive the sudden loss itself as a major visual disruption. And, of course, diabetic retinopathy, especially with diabetic macular edema swelling in the macula. That's a very common cause of blurred and distorted vision in people with diabetes.
Right. Some less common retinal things were mentioned too, like perture retinopathy.
Yeah, that's usually associated with severe compression injuries like chest trauma or pancreatitis. You see lots of cotton wool spots and hemorrhages in the retina. Vision is decreased and potentially distorted.
Shaken baby syndrome.
Tragically, yes. Extensive retinal hemorrhages, sometimes macular retinostasis, devastating impacts on vision.
And solar retinopathy just from looking at the sun.
Yes, staring at the sun, like during an eclipse without protection, can burn the macula. It causes photochemical damage.
Leaving a blind spot.
Often a central or paracentral scotoma,
Yeah.
a blind spot, yeah, and associated distortion.
Okay. Tilted optic discs. How does that fit in?
Sometimes the optic disc, where the nerve enters the eye, is just congenitally tilted or angled.
Yeah.
It's often associated with myopia and astigmatism, which can cause blur, but sometimes the retina around the tilted disc is stretched or thin fundus ectasia, and that can correspond to visual field defects, maybe some distortion.
And inherited conditions like
Yeah.
Stargardt.
Yes, certain inherited retinal dystrophies like Stargardt disease or pattern dystrophies cause changes in the macula over time, leading to central vision loss and distortion.
Toxic retinopathies too,
Yeah,
from medications.
right. Chloroquine or hydroxychloroquine are classic examples, potentially causing a bullseye maculopathy pattern with central vision changes and distortion.
Wow. It's not just the cornea, lens, and retina then. Even the optic nerve and neurological pathways are involved.
Absolutely. The whole visual system is connected. Optic neuritis, inflammation of the optic nerve, often seen in MS.
Multiple sclerosis.
Right. That typically causes a central scotoma, pain with eye movement, and blurred or sometimes distorted vision. Ischemic optic neuropathy, poor blood flow to the nerve, either arteritic, like in giant cell arteritis, or non-arteritic, causes sudden vision loss, which can be perceived as distortion.
Papilledema. Swelling of the optic disc.
That's from increased pressure inside the head. It can cause transient visual obscurations, like the vision graying out for seconds, and sometimes blurred or distorted vision if it's severe or chronic.
And issues deeper in the brain.
Definitely. Problems in the occipital lobe, where visual processing happens, can cause all sorts of visual disturbances, including distortions, hallucinations, or field cuts. Even things like vertebrobasilar artery insufficiency, poor blood flow in the back of the brain, can cause temporary, often bilateral, blurred vision.
Migraines too.
Oh, yes. Migraine aura frequently involves visual symptoms. Scintillating scotomas, those shimmering, jagged lights, or other visual distortions are quite common before or during a migraine headache.
Okay. So many potential causes. What about things like floaters? Are they distortion?
Not typically true distortion of the image itself. Floaters are shadows cast by clumps in the vitreous gel. They're more like obstructions moving across the vision. But people might sometimes describe them as a visual disturbance. Same with entoptic phenomena, seeing things originating within your own eye, like blood cells moving, not true external image distortion.
You mentioned medications causing retinal toxicity, but can other meds cause distortion?
Some medications can have visual side effects, including blur or maybe disturbances that feel like distortion. Always worth checking medication profiles.
And things like uveitis, inflammation inside the eye.
Yes, inflammation can certainly affect vision. Posterior uveitis, affecting the retina or choroid, is more likely to cause blur and distortion than inflammation just at the front of the eye. Conditions like VKH disease?
Vogue Koyanagi Hirata.
Right. That causes uveitis and serous retinal detachments, leading to significant visual disturbances. Even systemic infections like syphilis, toxoplasmosis, Lyme disease can have ocular manifestations, including retinitis or optic neuritis.
Okay, that is a lot of potential reasons for distorted vision.
It really is.
So with all of this information we've just gone through, what's the main takeaway for someone experiencing this? What should they be thinking?
I think the key thing is that distorted vision is a really broad symptom. It's not one single thing. And it has this huge range of potential underlying causes, from relatively benign things like dry eyes sometimes to much more serious conditions needing urgent attention.
Like a retinal detachment or wet AMD.
Exactly. The specifics matter a lot. The way your vision is distorted, is it wavy? Is it size changes? Where is it happening central? Peripheral? And how quickly did it start? Was it sudden or gradual?
Those are all important clues.
They're critical clues for figuring out the possible cause. And the good news is that many of these underlying conditions are treatable, especially if they're caught early. Early detection makes a massive difference for outcomes.
So the bottom line is pay attention to changes.
Absolutely. Pay attention to any new or noticeable changes in your vision, especially distortion. Don't just brush it off. It really warrants a prompt evaluation by an eye care professional to figure out what's going on.
That's a wrap for today's deep dive. I hope it brought some clarity to your clinical thinking. We've covered a lot of ground, from corneal irregularities to retinal conditions and neurological factors. Remember that each piece of information contributes to a larger understanding. Until next time, stay focused, keep learning, and don't forget to subscribe for future insights.